Well, tonight we take to the skies as we explore the critical role of medical helicopters in emergency response. News 19's Tate Wisey had the opportunity to join a medical helicopter crew on a flight to learn about the life-saving work they do.
That's right. I had the privilege of meeting one of Gunderson Air Systems medevac units to gain a unique perspective of what these brave men and women do day in and day out in order to save countless lives.
Since their inception in 1972, medical helicopters have become an indispensable resource for EMS units, providing advantages that you cannot get with ordinary ground services.
The number one advantage is speed. A lot of times, minutes are the difference between living and dying or having a permanent disability and not. One of the other advantages is that compared to a lot of the ground EMS services, we have a lot more training and a lot more capability, so we can take care of sicker patients and do what needs to be done to keep them alive.
Equipped with state-of-the-art medical equipment and staffed by highly trained medical professionals, medical helicopters are made to ensure that patients receive the highest level of care during transit.
We're basically a flying ICU. So if you see a piece of equipment in the ICU, we have a version of it on the aircraft. We've got the breathing machines, the IV pumps. We carry 50 different medications, fluids, we carry blood, we carry plasma.
These helicopters are designed to reach inaccessible or remote locations quickly to ensure that patients in critical condition can receive necessary care within the first 60 minutes after a traumatic injury or the onset of a medical emergency, also known as the golden hour.
One of the biggest factors on patient survival is reducing the out-of-hospital transport time. So if we're doing an inter-facility transport from one hospital to another, going from La Crosse to Madison is 2.5, 3 hours on a good day. And that's a long time to be on the road, bouncing down the road in a pretty dynamic environment, whereas these patients need to be in something fairly stable.
Whether it's battling through dense fog, navigating stormy skies, or facing winter's icy grip, the pilots of these flying ambulances are well trained to handle the stress that comes their way in an already stressful situation.
As a pilot, you really have to isolate your job. Your job is to get the med crew and that patient from A to B as safely as possible. So you need to remove the emergency from the situation and understand that you are a pilot, you are here to fly the aircraft, not work on the patient and get too involved.
As EMS helicopters continue to play a crucial role in saving lives, one thing remains certain. The skies above are no longer just open space, but rather a lifeline for those in need of urgent medical attention. Reporting 1,000 feet above Sparta, I'm Tate Wisey, WXOW, News 19.
Now, my time with the medical helicopter crew, even without an immediate mission, highlighted the dedication and commitment these professionals bring to their roles. Their tireless preparation is a testament to the importance of their work in providing swift and life-saving medical care. Back to you.
What an experience. All right. Thank you, Tate. Now, in order to ensure 24/7 preparedness, these flight crews, they work in 24-hour shifts, and they have small living spaces at the airport that they stay in during any downtime.